Okay.
All right, so now we're going to do an IV start. IV insertion, okay? The supplies you're going to need is called your IV start kit. You've got your IV catheter. This is a 22 gauge, 1 inch long, the needle that actually you use to insert into the vein. If this was, the lower the number, the bigger the needle is, okay? We've got 18 gauges. That's normally what they place in the ER, and they'll do it in the antecubital area. When you're on the floor, normally a 20, 22 gauge is good. If you're giving blood products, they normally want at least a 20 or 18 gauge. So when you're documenting, you'll have to put what gauge and where you placed it at. This right here, we call it a J-loop, and I'll show you how this will connect into the catheter when we get to that point. This says clear link on y'all's stuff that's in your kit. And then we've got a saline syringe that we'll use to prime our tubing, okay? So I'm going to go ahead and open this up, open up my supplies. You can take this and set it out. Don't take the cap off. Then we're going to open up the kit part, and it has multiple things in there, and I'll show you. All right, got your tape. You want to get a couple pieces out and get them ready. I'm just going to leave it like that for now. Let me go ahead and show you. This is the ChloraPrep, and I'll show you how to pop that, and that's what you'll actually clean the site with. Okay, we don't want to lay it here because we want to get our site clean. This is your tourniquet. You can throw away the rubber band, and this unrolls. Okay, I'll set that there. These are just gloves. These are not sterile gloves, but they do come with gloves that you can use. And then you've got the 2x2. And then this is the Tegaderm that will go on the IV side. Okay, so we're going to leave that in there. I personally just curve the paper right there so I can get a hold of it real easy. Okay, so we've got all of our supplies. We've come into the room. We've made sure that we've identified our patient. We've asked them about allergies. Before you do an IV stick, you want to ask the patient if they've had a mastectomy or if they have a dialysis shunt. Same thing whenever you were taking blood pressure. Those two questions are the same. If they have a dialysis shunt in this arm, you want to try to use the other arm. Same thing if they've got a central line or a PICC line up in their upper forearm. You don't want to do an IV. If there's any reason, like a mastectomy, remember we want to try to use the other arm. So we've asked our patient those questions, and now he said, yeah, we can use this arm. So now I'm just going to look and get an idea of where I want to start my IV. So you always want to start at the most distal area. You don't want to start up here because you can't backtrack. So you want to look at the hand first. Okay? If there's nothing in here that you can get, then you can move up. If you had a scenario where a patient had an IV here in the forearm, say it infiltrated and you had to take it out, and you've got to replace that IV, you've got to go above that site, okay? You can't go below it. So this actual arm doesn't have the hand one, so we're going to go ahead and we're going to look at the forearm right here. And so you can take your tourniquet, you place it under the arm, pull. You don't want it too tight, but you want it snug enough. So you do this, and then you tuck it under. Okay? This lets the blood fill up. It makes the veins pop out. And you can come in here, and you want to see what you can feel. Look and see if you see any of them. Of course, I would have looked at my hands, but on this model, we just have the forearm ones. So I'm going to go right here on this one. That looks really good. We're going to start here. That's where I'm going to insert. So you want to pop that tourniquet, release the pressure. If you leave it on, it really starts to ache. Same way if somebody was taking your blood pressure and they pumped up and they were letting the air out real slow, your arm kind of aches. Same concept. Okay, so I've done my hand hygiene. Right. I'm going to set up my stuff. So here I'm going to take my tape You just take about a 2-3 inch and you want to split it in half. And this is what we teach y'all in the beginning. It just helps, and you just, I'll show you how you secure your catheter tip. So we're going to place that there. So we've got our tape handy. We've looked at our IV catheter, and I'm going to go ahead and pop the lid off. And I want to show you, you've got a little tab here, okay? That's where your index finger is going to go on your dominant hand. So your finger goes here, and then you kind of gently grab and stabilize with the back, okay? If you'll notice at the end of the needle here, it's called a bevel, and it has, that's where the hole for the IV catheter is. Can you see it? You can't really see it, but when you get your hands on it, you'll see it. So we always want to go bevel up. Bevel up is the same side as this little tab that your index finger is going to go on, okay? So I'm going to recap it. Be real careful. Remember about recapping needles and stuff. So that lid's a little loose, and I can leave it like that. I've got my Tegaderm, and I'm going to go ahead and I'm going to take my ChlorPrep. I'm going to put my gloves on, and we're going to clean our site. You want to clean your site in a circular motion, starting from the inside of where you're going to go into the vein, and then you rotate out. And I'll show you real quick. So I've got my gloves. We'll take the ChlorPrep. You squeeze these two wings. See how it pops? Squeeze it down. And that gets the little pad wet. So we said we're going to go here. So I'm going to start in the middle, and you do a circular motion. And you start getting bigger and bigger till you're all the way out. Okay, don't need that anymore. So your site is now wet. You want it to air dry. Do not fan it. Don't blow on it. You just contaminate it. So we're going to have to let it air dry on its own. So while it's doing that, I'm going to take my J-loop here. We're going to